It's me, Dr. Jericho Cordero po. Well, andito po tayo because for quite some time, papansin lang po ninyo, by the way, just to give you an information, kami po sa LBNA, we had been meeting po kami. We have been discussing kung anong naging mga approach natin. So, ito po mga nangyayari po. Tapos, with that, ako po I am also a frontliner. So, pardon me, medyo busy din po. I have to do my job as a doctor to the Filipino people. But thank God, binigyan po tayo ng pagkakataon po. Kasi I feel as a doctor, I really have to share to straighten out some information, give na tamang information, at nagpapasalamat po ako for this opportunity. By the way, thank you din po sa BOD natin. Bakit po? Just to give you an information kung paano mayroong foresight at vision po itong ating mga leaders. Way back, before pa po nagkaroon ng quarantine, I had that privilege to attend the meeting with our leaders and the BOD, of course. And with that, makikita mo kung ano ang discussion. It's about welfare po ng bawat isa po sa atin. So salute again to our leaders. Maraming salamat po. And of course, I salute also the other frontliners, not only the doctors, the nurses, the medtechs. It goes way back or way far, no? Sa lahat po, yung nasa field, yung nasa grocery, nasa pharmacy, the food servers, even the orderlies ng mga hospitals, ng mga institutions rather natin. So, saludo po ako sa inyo. And of course, I would like to call again and salute yung mga ka-LBNA members ko po. Kami po ay, we are here to guide you. Sabi nga po, kami pong LBNA, kami po ay health educator. We are also a health advocate. And we are supposed to be, dapat naman po, role models. Now, why am I here? What is going to be discussed ngayong umaga nito? Well, one, kailangan po natin ma-emphasize ang mga tamang impormasyon. By the way, when it comes to information, kasi tad-tad na po tayo sa mga false or fake news, I strongly advise na even in my discussion o sa ating mga grupo, it should be coming from the Department of Health. Yan po official. So anong sinabi po ng Department of Health, yun pong impormasyon na kukunin natin at susundin natin. Okay? Of course, the WHO kasi naka-align naman po yun. Now, with due respect to the institution, stakeholders, researcher, or group of doctors maybe outside of the DOH or WHO, ako'y nire-respeto ko yan, but to avoid confusion po, ito na po tayo. Okay? Para mas maganda. Now, there are also may mga kauno din po tayo na nag-PPM sa akin, asking questions, including sa LBNA, ano po ba ito? Anong ibig sabihin ito? So, I try to gather those questions that along the way, as I discuss po about this so-called pandemic, this pandemic, tayong mga kauno, what is our role? Ano po pwede natin gawin to maintain a good health? Yun po ang bottom line doon. So, I will try to correct those information. I will try to add more information and probably confirm those information. Ganun po ang gagawin ko. So, let me start. So, I believe at this point na naka-quarantine po tayo, ito ay kilalang-kilala na po ninyo ito. Obviously, this COVID-19. So, just to give you a background, way back December, ang mga doktor doon, they noticed that a certain cluster of people nagde-develop po ng pneumonia, infection of the lungs. So, they took a history, tinignan nila yung background, they noticed that those group of people ay galing po sa isang lugar in a marketplace wherein wild animals are being sold, So, and well, they claim are also part of the delicacy, or they are eaten. So, yun po naging simula nito. one thing lead to another until sometime January of 2020, ito po ay na-identify under a microscope, no? So, under a microscope, by the way, may nagtanong po sa akin, yung microscope po ba natin, Doctor, sa LVNA, or even in the regular hospitals, kaya po ba ma-visualize under the microscope ang virus na sinasabi ko? The answer is no, because there is a higher or more specialized type of microscope called electron microscope. Wala po tayo nun. So, yun po ang isang fact that I have to share. Okay? So, wala po kami makikita under the microscope using our microscope. So, when they visualize this one, they notice if this is the virus, for example, a representation of the virus. All around it, napansin po nila, meron pong projections. May mga spikes. That's why they name it as the coronavirus. Kasi corona crown, so those projections. And another thing to correct is that initially, some even doctors thought that it is just like a common cold. Hindi po. Hindi po. Mas iba po ito. So, ito po ang nakita nila under the microscope. In their further studies po, they tried to determine the MOT, the mode of transmission. Anong ibig sabihin po ng mode of transmission? It is how you transfer the disease to another person or to another host. So, based on their study o pag-aaral po, they came up, isa po na kaparaanan ay yung sinasabi nating droplet. Paano po yun? Well, when you cough, sneeze, or even ordinary talking, for that matter, somehow you are transferring droplets of your saliva into to somebody else or to a surface. That's the reason na pinapamask po tayo. Especially yung mga areas na at risk, no? Pinapamask po tayo. So, yan ang isang rason. Now, another mode of transmission is the contact or close contact way, no? Ibig sabihin po nito, it involves, no? Dun sa mga, lalo na sa mga surfaces. Meaning, kaya nga po nag-advise po ang DOH, di ba, may certain meters pa nga po. Stay away at least a meter. In other countries, they're saying 2 meters. So, ganun kalayo po. Kasi, base sa pag-aaral nila, that this droplet, it can travel at that certain distance, no? So, kung may social distancing po tayo, the idea is you won't be able to transfer it sa iba. Okay, ganun pong ibig sabihin nito. Now, dito naman sa contact, particularly the so-called touch, sa mga surfaces, doorknobs, tables, maybe you were able to, or accidentally, unknowingly, touch that area. Tapos po, upon touching that area, ay medyo humawak po kayo ng ilong ninyo, mouth ninyo, eyes ninyo. That can be also a transfer, no? Way to transfer the disease. So ito nga po sinasabi namin, may kasabihan po kami, don't touch men. Ano ibig sabihin po nito? Ang ibig sabihin po ba nito, bawal humawak po ng lalaki? Nako, baka may mag-react. Klaruhin ko po, bawal ang fake news. Eka na po. Ibig sabihin ng men stands for the mouth, E for the eyes, and N is for the nose. So in other words, if, especially nowadays, no, na there is a possibility that the droplet went there, it is infected, you should wash your hands and also avoid touching those areas. Kasi baka nga po mag-transfer. Now, more than that, allow me to erase this one. So, meron po tayong sinasabing base sa pag-aaral, which is very important at may implikasyon po sa atin, ang sinasabi nating risk factors. Ano itong mga risk factors? We have to know this because although the other factors are so-called can be determined in the laboratory clinical setting, meron po dito na commonly makikita natin. Ano po ito? Because it affects how we deal with this disease. One, the so-called age. Based on literature, nakita po nila na ang edad ay may factor po para ikaw ay mas magkaroon ng sakit or mas mahawaan ng sakit. In fact, they notice age 50 years old and above. Lalong-lalo na po dun sa, I think in one European area, Italy, kung di po ako nagkakamali. Their population is around 35% ay mga nasa older bracket, age bracket. At pag tinignan nyo po, yung mga naging mortalities, great number ay nandito po. So yun po ang isang nakita nila. So probably at home, tignan po natin yung ating mga magulang, lola, probably mga kapatid, no? They are at risk. Okay? Yun ang ibig sabihin nun. So ibig sabihin nun, dahil ang kagandahan nito, we know that one, so knowledge is very important. So alam na natin na we have to take care of that, extra care of that. Next is the so-called, ito very important po. In fact, we tend to neglect this one. In fact, I notice that once we take a certain supplement, nakakalimutan natin yung other part of it. Okay? Explain ko mamaya regarding sa practice na ginagawa po natin and the strategy that we want you to follow para a healthy body nga po. Ito po yung sinasabi nating comorbid diseases. Ano po ang comorbid diseases? Ibig sabihin po nito, ito yung mga sakit na currently, well, you have, no? Meron po kayong mga sakit. Anong implikasyon nito? Or what are first the comorbid diseases in relation to this COVID-19 ang napansin nila? Na medyo very common and it affects your prognosis o yung kung ito ay gagaling ka o hindi. Number one po dyan, I'll use another pen para mas klaro. People who are inflicted or who have a so-called hypertension, high blood po. Yan napansin nila. A great number, may ganitong sakit. At ang kanilang mga kuan po, depende po how they are managed, how strong ang immune system nila. Doon po naglalaro yun for them to survive from positive going to totally negative. Of course, healthy person. Ano pa po ang nakita nila? Ako, ito, marami ito. Worldwide pa nga ito, not only in our country. The so-called diabetes mellitus. Diabetes. The sugar, there's a problem with the sugar. So marami-rami po ito sa ating, even in our country. And even in our mga kauno. Pansinin niyo po, meron po ba kayo, ito ang challenge ko, meron po ba kayong kapamilya who has this disease? Okay? Kung meron po, again, right forum po ito to discuss this one para makita natin ano bang strategy natin ito. Okay? First, we are in quarantine. Diba? Anong gagawin po natin? Sige, may solution po tayo dyan. Smile lang po tayo, ha? Smile lang po. Keep on praying, but do the right thing. Okay? Next, after hypertension, diabetes, CVD, cardiovascular diseases. Ito po yung problema po sa puso. Usually yung, secondary, usually ang common risk factor naman ito if you have high cholesterol. No? Of course, hypertension is a risk factor. So mga nagkaka-heart attack o may problem sa puso nila. Isa po yun sa na-identify. And there are a lot of comorbid diseases. Name it, kidney diseases. Kung may problema po. Pulmonary problems, ano po yun? Meron po ba kayong asthma? Bronchitis? Even the common, sorry for the word common, yung problem sa mga joints, arthritis. Arthritis, if you look at the pathophysiology, one of the pathophysiology which is the so-called the immune system. May problem sa immune system. Okay. So what else? Maliban pa po dito, include ko rin po stress-related diseases. Stress-related diseases. Now, obviously, with this setup natin sa buong mundo, in our country, definitely stress meron po tayo. Ang pinag-iba lang po natin, no, is that how you manage it. Doon tayo magkakaiba. How you resolve that stress. But that stress has an effect on our body. Tandaan niyo po yun. I will explain it further later. So ito po ang mga possibilities. Ito po ang mga risk factors na medyo can affect our health. These factors, pwede po natin ma-manage. Itong mga effect nito, pwede natin ma-manage. Of course, you cannot manage. Sabi nga nila, if I'm 56 years old, how do I manage? Gagawin kong 41 years old. Hindi naman po yun ang ibig sabihin ko. So, these are just risk factors. Okay. Now with that, we now go to the so-called strategy. Ano po ang strategy natin? Ano po ang gagawin natin amidst a so-called pandemic condition or crisis? So, ano by the way ang difference ng endemic, epidemic, at saka pandemic? So, endemic, maybe the case, the disease, the infections, just stays there, no? Certain time, certain place. Probably, in a year, sorry for the word, common lang na may 10 ganun na incident in a year. Ang epidemic naman iba po. Kung dati, in a year, 10, biglang dumami po on that certain area. Instead of 10, naging 50, 100, probably. Medyo malaki-laki na po yung figure. But on the same place. But the moment such disease marami na po, and it goes around different countries, that will become a so-called pandemic. Di ba initially there was a call for the WHO to classify COVID-19 as pandemic, but initially meron pang criteria po na sinusunod. Anyway, so what is our strategy? Allow me to erase this one. This one. Strategy. How do we keep ourselves healthy? Diba? Ang palagi ko pong sinasabi, unang-una, I like what Jericho shared, no? Kung anong na-share niya. Lahat po tayo dapat meron nito. Shape. And every one of us, alam natin kung anong ibig sabihin ng shape. Now, ang gagawin ko po, I will emphasize na itong shape na ito napaka-importante na po ito. In fact, if you just take in your medications or supplements without the shape, ganun din po yun. Parang, let's have this example. Ikaw po ay may sakit na hypertension. Okay, hypertension, high blood po kayo. Binigyan po kayo ng gamot ng doktor ninyo. By the way, sa LDNA, we practice complementary medicine. We follow kung ano pong sinasabi ng mga doctors, ano ang nire-recommend. Now, you took that medicine, pero kakain ka naman ng mga bawal, salty, fatty foods. Sedentary ang buhay mo, you don't move yourself, wala man lang exercise. Your mind, puro stress, no? You don't know how to cope with stress. So yung mga ganun po na mga risk factors, kahit po may gamot, mahirapan po yung gamot. That is why, let us be truthful in here. Tayo po sa kauno, we are blessed kasi we were, nasharean po tayo ni Jericho ng ganitong strategy. Shape. Ano po ang shape? Di ba? So, as a rundown, tingnan niyo po anong epekto. Ang taong walang poor sleep pattern, may problema po. Bakit? Anong epekto niyan sa atin po? According to study, pag po, merong sinasabi tayong lack of sleep, quality of sleep. Yung mga soldier cells natin sa katawan po, nag-i-slow down. Parang sluggish po sila to the so-called invading pathogens or infection. Mahina po sila. So, anong problema doon? Siyempre, kung ganun kahina po ang sundalo natin sa katawan, obviously, infection will win. So, obviously, we get sick. So, tama po. Total naka-quarantine naman po tayo ngayon. Dati ang rason natin, ay di namin kaya kasi po, busy po kami. May trabaho po. I don't have that quality sleep because of my work. Ngayon po, siguro naman dahil nasa bahay po tayo, dapat nasa bahay tayo, find time to have good quality sleep because you are helping your body. Tinutulungan niyo po ang katawan ninyo the cells, itong sinasabi niyong immune system, yan po, tinutulungan niyo po. What else? You have to hydrate yourself, no? In my practice, ito po sa akin po ang ginagawa ko, from time to time, drink water, drink the prime juice. Sometimes din po sa water ko, I would cut lemon, tapos ilalagay ko po, then drink from time to time. Kailangan po yun. Bakit po? Why do we need to be hydrated? As we all know, 60 to 70% of our body is made up of water. And a good and a hydrated body ay mas nakaka-function ng katawan natin. The idea in shape is that we will help ourselves. We will help ourselves. Tutulungan po natin ang ating sarili po. No? Hindi po natin naabusuhin. Kasi God gave us a very, very good, His plan. No? Ang ganda ng ginawa niya po. Pero niyo po, meron po tayong sariling sundalo. Has the ability to, our body has the ability to heal ourselves. Ganun po ang wonderful ang ginawa ng Diyos. Kaya lang, inaabuso natin. We do take in mga bad food, toxins, those environmental na mga insults sa katawan natin. Hindi po maganda. So ano pa po? Of course, nowadays, you must have good air. Part din po yun. No? Of course, find a area po na medyo okay ang air natin. Breathe in, breathe out po. Meditate. No? Para yung stress din po. By the way, ulitin ko po. The stress, the moment, maybe in next discussion ko, papakita ko po sa inyo. How does it look like? Kung ang meron pong stress, ano po nangyayari sa cells? Para makita ninyo, pag na-stress po tayo, lack of sleep po tayo, makikita niyo yung movement ng cells. Naku, kawawa po. No? What else? Aside from that, of course, we are in quarantine, pero ang sinasabi ko nga, baka magka-problema po kasi we need to eat healthy foods pa rin po. So, probably, may solution naman po yan. No? You have to coordinate probably with your barangay officials kung saan po makakakuha. Probably you have a stock sa inyo po. You choose something that is more healthy or healthy one than the bad ones. It's quite hard, pero may sasabihin po ako later regarding sa diet natin at ang effect natin. Sa atin rather. So, what else? Naku po, wag niyo pong kakalimutan. Mag-exercise naman po tayo. Alam niyo po, nung una, kung sabi natin, ay masyadong busy po ako sa trabaho ko. No? I have no time to exercise. Ngayon po, tignan niyo po, you have a lot of time to exercise. You just have to do it. Mag-start ka, do it, and maintain it. Okay? Paano po ba ang exercise natin? Hindi naman po necessary na para naman po siguro atleta. Unless kaya ng katawan mo. But with a limited space, eka nga po, at condition, pwede po mag-exercise. Make it a point na mag-exercise po kayo. And of course, very important with this so-called diet, dahil nga po sa situation natin, nung wala pa nga pong infection, may problem tayo sa diet, no? I also strongly advise, take in your supplements. Kailangan po natin yun, especially ngayon that our food choices are very limited. Our activities are quite hampered. Okay, let me give you my bold prediction at hindi naman po ako nananakot po. This is from me and based on my observation. Kanina, I told you about the comorbid diseases. Now, ito po. Please listen. Pag tayo po ay hindi proper ang ating approach, hindi natin minanage, hindi natin kinorek itong comorbid diseases. Those of you, mga kasamahan natin, na meron pong at this point mga sakit, after the quarantine, magkakaproblema po. Lalong-lalo na po let me make the qualification, if you don't practice properly good health habits po, magkakaproblema po tayo doon. Ang iba naman po, pangalawang population doon, yung iba naman po, nung wala pa po yung COVID, probably very mild or subtle lang po ang kanilang condition, okay? Kanilang morbid diseases. Well, dahil nga very limited tayo, again, the qualification is poor health practices natin ngayon, baka po after the quarantine, magpampo yan, lumabas po at magkakaproblema. That's why, ako ang nakikita ko po dito, tayo dito sa Kauno, habang we have the time, ito ngayon po na naka-quarantine tayo, let's make ourselves healthy at address natin properly ang mga ang health natin. Again, address it properly. Okay? So, lahat tayo dapat nandito sa shape. Okay. Now, after the shape, pag tinanong ko po kayo, pag may infection kagaya ngayon, pandemic 1, how do you keep yourself healthy? Ito po kagad ang sagot. Boost your immune system or your immunity. Well, tama naman po. What do we exactly mean when we say boost your immune system? Ibig sabihin po, simply saying it na tutulungan natin ang ating katawan, yung sundalo ng ating katawan, to fight the disease. So, paano po natin natutulungan yan? Balik po tayo dito. Shape kagad. Okay? Gusto mo maging healthy? Shape. Okay? Now, what else? We take in supplements, di ba po? Now, pag sinabi pong boost your immune system, mga kauno, anong kagad ang nasa isip ninyong supplement? Vitamin C kagad. Tama naman po. That is good. But let me tell you, in order for our body to have an immunity that is strengthened, vitamin C is very good. No question about it. We have literatures, we have journals telling us to do so. Nutritionists telling us to do so. Pero, hindi lang po yun. Meron pa pong mga ibang ingredient. Let me tell you, ano pa pong mga ingredient yan? Well, just to name a few. Okay? One is, I think na-post na po natin to sa FB page natin. I gave a suggestion. No? You need also zinc. You need also the other vitamins. Kailangan, even the B complex. What else? Well, you even need protein. So mapapansin ninyo, by the way, I'm just mentioning a few of it, no? Marami pa po yun. In other words, ito po, kung ito po ang target natin, to boost the immunity, bago makarating dito po, may mga kailangan po ayusin. At ito sila po ang kailangan natin. Okay? What else? Pag sinabi natin boost immunity, yun po ang nasa isip natin. What else? To be healthy. Ito po ang isa pong nakakalimutan natin. In fact, ang tingin ko nga po, if not as important as this one, gusto natin maging healthy, ayusin din po natin itong pangalawa. What is that? Manage. Manage the comorbid diseases. Okay. I have explained a while ago. Oo nga, you have done or nag-take po kayo ng mga kaparaanan, eka nga po, to boost your immunity. Tama po yun. But if you are carrying a heavy bag, if you are carrying a problem na comorbid disease, babalik din po yan sa boost ng immunity. At paano po babalik? Mahihirapan din po ang pag-boost ng immunity. Why? This one has its own problem that has to be addressed. Kailangan po masolve natin. And here's the good news. I have been looking at our supplements, no? I've been looking at our supplements, at a lot of our supplements, no? Super brand nga po eh. Nakita ko po, there are a lot of supplements that does not only give you good immunity or help the immune system, it addresses also this one. Ano pa po ba? For example, yung may pinapost ako na about grapeseed, di ba? I told our leaders, sabi ko, sir, alam niyo po ba, ang grapeseed is 50 times, has 50 times more potency than that of a vitamin C. 50 times, 30 or 20 times more potency than that of a vitamin E. Grapeseed. For example, ang isang tao po ay may hypertension. In this current situation natin na meron tayong infection, COVID nga po. Okay naman kung nag-vitamin C siya, no problem po. But if I take grapeseed, I am hitting two birds with one stone. Nagkabaliktad na. 2 birds with one stone. Ano po yun? Well, with that grapeseed, I am boosting my immunity. Wow, that's good. And I am also managing my hypertension. Why? Because grapeseed, maganda po yun sa mga blood vessels. It relaxes our blood vessels. Kasi pag tense, matigas po ang blood vessels, not elastic anymore, or it has thrombus or pagbabara, may problema po yun. Kaya nga tumataas ang blood pressure. Kaya nga po, pag mataas ang blood pressure, alam din po natin ano mga tinatamaan ng mga disease. Hypertension is just one aspect of it. Pero yung mga sakit na nalululot po, ang dami. The kidney, the brain, and the heart. Especially those three. Very important. So, if you get my point, if you keep on boosting your immunity, tama po yun. Continue with that. But manage also these comorbid diseases and look at our products. Nakita niyo po ba? Even the so-called crypto-organic. Di ba? Meron po yung chlorella. Ay ano po yun? Abay, it's very rich in zinc and even vitamin C. Meron po rin po yun. At maliban pa po doon, anong effect ng product na yan po o ng supplement na yan sa atin? Marami po. It can help you lower your cholesterol, your sugar. Ang dami po. Okay? Kung may rayuma kayo, it can help you. Why? Because 1, 2, 3, here is the third important na strategy natin. So, ulitin ko po ha. We start with shape. Bago dito muna, shape muna. Okay. What is the third? The third one is to take care of the free radicals. Okay? Ano itong mga free radicals? Ito yung when you eat something, when there's a body process, when there are toxins in the environment, it produces free radicals. Kumbaga sa sa environment natin or even in our house, those are the dirt. Those are the mga items na di kailangan. Ang problema, you put it there, it will affect the other areas. And in our body, in our case, pag maraming free radicals, based on studies, it can lead to a lot of diseases. Okay, dito ko na lang po isulat, Now, why do we have to consider the antioxidant capacity? Or as part of our strategy, dapat may antioxidant. Because these free radicals, FR na lang po ha, free radicals, ito po ay magkaka-problema tayo. Sa pag-aaral po nila, one of the common denominator, especially ng chronic diseases po, chronic diseases, yung mga comorbid na minention ko, one of the most common denominator po doon ay ito po. Inflammation. Let it be. Kung heart attack man yan po, atherosclerosis, ibig sabihin po pagbabara, hardening of the blood vessels, there is a pathophysiology called inflammation. Diabetes, meron po. Arthritis, meron po. So, we can correct this one by taking something that will eliminate the free radicals. At ito na po si antioxidants. Now, the good news na naman po mga kauno, look at our products. Ang dami po dun. We have the acai berry. My favorite yung barley and wheatgrass. Paborito ko po yun. Kasi marami pong effect. It helps me in my sa well-being ko po. Of course, maganda po yan sa so-called elimination. Kasi we have to remove toxins from our body. It gives you energy. So maganda po. Ang dami pa po. Please don't forget that one. Ulitin ko po mga kauno. The strategy. Number 1, at basic to all. Bago i-take ng mga anumang mga supplement or gamot na in-advise ng doctor, shape muna. So take care of your sleep. Dapat tamang pagtutulog, time of sleep or quality sleep, no? Another is you have to be hydrated. Drink properly. Meron po tayong juice. Inumin niyo po yun. In fact, yung juice natin po, if you look at that, para pong, kung tutusin, para pong multivitamins po yun. I won't be mentioning the brand, other brand, company, pero para multivitamins po. Kumpleto po. Ang ganda po. It has an antioxidant. Don't forget that one. Napakaganda po. It is refreshing at maganda po sa katawan. You have to have good air. You must have good exercise po. So mag-exercise po tayo. Tapos po, aside from good exercise, again, have good supplements din po. Diet. The diet. No? Don't forget the good diet. Okay? So, if you have this one, dito na po papasok itong tatlong strategy natin. 1. Boost your immune system. Second, kaparehas po, ka-level po na importance, manage your comorbid diseases. Again, I'm reminding you the possibility that after this quarantine, pag hindi po ngayon po mag-correct, if you don't correct it, magkaka-problem po tayo dito. Because again, the qualification is poor health habits, no? Tapos meron kang comorbid disease. Grabe po yun. Problema po yun. Okay? And lastly, kaparehas din po, antioxidants. We need something to clean ourselves. We need something that would eliminate those toxins na hindi kailangan ng katawan natin. Again, with that, ako'y nagpapasalamat po sa oras ninyo. Nagpapasalamat po in God's grace po. Maraming salamat po. I am hoping po that you stay healthy po. Sumunod lang po tayo, stay positive in our mindset, in our outlook. Wag pong positive sa COVID, ha? So, be a good citizen. May mga obligasyon po tayo. Sabi nga ng isang leader, if you stay home, hero din po ang tawag. At ito pong isa pong pakiusap po sana. Sana po, wala pong uno na, na magiging pasaway po. Tayo po'y nangunguna nga po to be very obedient. At syempre yung mga kababayan ko, yung mga waray, ha? Ayaw kita pasaway, ha? Dapat maupay kita. Okay? Baga, masunuran kita. And to our leaders, headed by Sir William, and of course, the BOD, Sir Gary, top earners and leaders po natin, nagpapasalamat po ako sa inyo. And of course, the whole UNO po, salamat po. I am Dr. Jericho Cordero. I'm a doctor to the Filipino people. God bless at mabuhay po kayo.